All right, so now that we have covered the intrinsic muscles of the tongue, which are responsible for fine movements of the tongue, so small movements of the tongue, let's get into the extrinsic muscles of the tongue, which are more responsible for larger, gross movements of the tongue. So the extrinsic muscles of the tongue, they originate on some other structure in the body and then course over to insert into the tongue itself. So they're not so much involved in articulation as they are involved in the actions involved in swallowing and singing and things like that. The first muscle that we're going to talk about is the genioglossus. You can see that it originates down here on the posterior surface of the mandible, and it fans out inferior to superior to insert into the entire length of the tongue. Different sections of the genioglossus have different functions. So let's start by looking at the anterior fibers, so those that are most in the front. So if we look at these fibers of the genioglossus right here, you can see that when those retract, they are going to pull the tongue down into the floor of the oral cavity. And if the tongue tip is protruded out, then contraction of those anterior fibers is going to pull the tongue back in, the tip of the tongue back into the oral cavity. So the anterior fibers of the genioglossus are responsible for retraction of the tongue. Now, if we look at the posterior fibers, so these fibers down here, so they fan out like this and insert into more of the root of the tongue. So if you take the root of the tongue, the posterior, the root or the base, and those muscle fibers contract, the posterior fibers of the genioglossus, then you're going to pull the root or the base of the tongue towards the back of the mandible. So if the base of the tongue is pulled forward, then that is going to protrude the tip of the tongue out of the oral cavity. So the posterior fibers, when contracted, protrude the tongue. The anterior fibers, when contracted, retract the tongue and pull the body of the tongue down to the floor of the oral cavity. And when they both contract together, you can imagine that the tongue will be depressed down into the floor of the oral cavity. So the next extrinsic muscle of the tongue we're going to talk about is the hyoglossus. So looking down here at this image of the hyoglossus, you can see that the hyoglossus originates on what is the greater cornu of the hyoid bone, and then it courses superiorly to insert into the sides of the tongue. So hyoglossus runs from the hyoid to the glossus, which is the tongue. So you can see that if the hyoglossus is right here, that when this muscle contracts, it's either going to elevate the hyoid, which we've already covered, or it is going to pull the tongue inferiorly, the sides of the tongue inferiorly towards the hyoid. So the hyoglossus, the function of the hyoglossus is pulls the tongue down and back, and this would be for the production of your low back vowels. The hyoglossus comes into play for those vowels. Okay, so the next muscle is the styloglossus. And the styloglossus runs from the styloid process of the temporal bone on the skull, and that is back here behind your mastoid process, which is that bump right here behind your ear. So it runs from up here down to insert into your tongue. So you can see just by the nature of the angle of this muscle that when this muscle contracts, it is going to pull the tongue back and up. And also, if you look at the angle of the fibers of the styloglossus, so coming down at this angle right here, and if you look at these fibers of the genioglossus, you can see that some of the fibers of the genioglossus will directly antagonize those muscles of the styloglossus. So whereas the styloglossus is going to be responsible for pulling the tongue back and up in the oral cavity, you have some fibers of the genioglossus that are able to pull it in the exact opposite direction, forward and down. All right, so the next muscle is the palatoglossus. So the palatoglossus originates within the soft palate. There's a tendinous structure within the soft palate known as the palatal aponeurosis. And then it courses down to insert into the sides of the tongue. So let's scroll down a little bit and find one of my illustrations. All right, so looking at this image, you can see that here's the soft palate, here's the tongue, and this orange bands of tissue here that run from the soft palate down to the sides of the tongue, that is the palatoglossus. So palate meaning soft palate, glossus meaning tongue. So if you think about what does the function of the palatoglossus do? Well, it's going to do one of two things. Palatoglossus, it's either going to work to elevate the tongue, so this muscle is going to shorten to raise the tongue. You can see how that would happen. Or the tongue is going to stay in its place, and the palatoglossus is going to contract to pull down on the velum, thereby assisting in opening the velopharyngeal port by lowering the velum. And we're going to come back to the palatoglossus when we talk about the muscles of the velum here momentarily. Now we're transitioning into muscles of mastication. So these are those muscles that are responsible for your ability to chew, your ability to move the mandible, to break down food in your mouth and form it into a bolus to get it ready for a swallow. And we've already covered a lot of these muscles in other sections, such as suprahyoid muscles. But now we're going to talk about them not in terms of how, for instance, how the digastric muscle pulls the hyoid up and back, but how it could also work to pull the mandible down, thereby opening the mouth. So we're going to look at these muscles and see how they affect your ability to masticate. All right, the first and probably most important muscle of mastication is the masseter. Looking at this image here, you can see that the masseter originates on the zygomatic bone, and it courses down to insert into sort of the base of the ramus of the mandible. And if you put your teeth together and if you clench your jaw, you will feel the masseter flexing right here. The function of the masseter is to elevate the mandible for the purposes of mastication. So the masseter doesn't depress the mandible, but once the mandible is depressed, the masseter elevates and it holds the bottom teeth tightly against your top teeth. as you grind up food. And the mandible is very superficial. It's just beneath your skin. And it's a large muscle of the face. It's a large muscle of mastication. Looking down here, you can see the skin stripped away on this cadaver. And that is a prominent piece of muscle right there. All right, so I'm going to play a bit of a video here. So here is the masseter. Here's the temporalis originating up on the temporal bone and coursing down behind the zygomatic arch to insert into the coronoid process of the mandible. And if you remember, there is the condylar process of the mandible, and that is the one where the mandible articulates with the skull and hinges with the skull. And then there, just anterior to the condylar process, was the coronoid process. And we mentioned when we went through the mandible that that is a point of attachment for muscles. And so this is one of those muscles that attaches at the coronoid process. So here we have our guy, and the mandible is down. The mandible is depressed, and you're going to see when these muscles shorten, contracting, they're going to elevate the mandible. And so you have the digastric down here that is working to pull the mandible down. We're going to get to that in a minute. The digastricus can be a depressor of the mandible. But here in this illustration, you see the masseter and the temporalis working to pull the mandible up. And this is primarily for the purposes of mastication, meaning chewing your food. All right, so whereas the masseter and the temporalis are primary elevators of the mandible, you have a couple of more muscles that are deep to the temporalis and the masseter, and these are called the pterygoid muscles. And if you look at the direction of which the muscle fibers of these two muscles run, you can imagine how they affect the mandible when they contract. So first of all, let's start with the lateral pterygoid. So it's lateral, meaning it's more sideways. It's more transverse. So this is running between the mandible and the back of the maxillary bone. And you can see that when the lateral pterygoid muscle contracts, it is going to pull the mandible forward. So the lateral pterygoid muscle is responsible more for protruding the mandible. And this is important for when you're chewing, that rotary movement. Your mandible is going side to side, but it's also going front to back. So the lateral pterygoid muscle is responsible for that front to back motion while you're chewing. Now, if we look at the medial pterygoid, it courses from the mandible. You can see it here down, originating at the ramus of the mandible, and then it's reaching forward and up to insert into the back of the maxilla. So the medial pterygoid is going to act more as an elevator of the mandible, but it also can work on some level to assist in protrusion of the mandible, because it does have this sort of posterior to anterior angle. So lateral pterygoid is more about pure protrusion of the mandible. medial pterygoid is about elevation and protrusion of the mandible. And looking down here at the digastric muscle, we covered the digastric when we talked about the hyoid bone. And recall that we said there is an anterior belly and then there is a posterior belly of the digastric muscle. So if these two bellies contract simultaneously, they could work to elevate the hyoid. If the anterior belly contracted, it could pull the hyoid forward and up. The posterior belly is going to pull the hyoid up and back. But assuming the hyoid stays where it is, you can see that if this muscle contracts, if you shorten the distance between the back of the mandible and the hyoid bone, you're going to be depressing the mandible. So that digastric muscle, in the context of the mandible, works as a depressor of the mandible. And the same is true for the mylohyoid. So when we talked about the mylohyoid, we referred to it as a flat muscle that forms the floor of your oral cavity. And we mentioned that when it contracts, it could pull the hyoid up to the mandible. But if we keep the hyoid where it is, and the mylohyoid contracts, it is going to pull the mandible down towards the hyoid. So the mylohyoid can act as an elevator of the hyoid or as a depressor of the mandible. Also, last muscle of mastication is the geniohyoid, and we did cover this as well when we talked about the hyoid elevators. But looking at this image here, you can see it runs from the back of the mandible down to the hyoid. So this muscle could work to either elevate the hyoid or depress the mandible.